So the first question is, what does your company do? And more importantly, why does it impact and change and improve health equity? What are you doing in the health equity realm?
So as Dia mentioned, access to care through finances is a big part of health equity. And I think most of us are familiar with the social determinants of health wheel that illustrate that about 50% of the factors impacting health outcomes are somewhat financially driven. Access to finances, your environment, etc. We believe that cost is one of the biggest drivers, if not the biggest barrier to healthcare in the US, and we solve for that. 50% of the 70 million Medicare members have to make hard trade-offs between eating 2 meals a day, taking their meds, going to chemotherapy, paying their heating bill. And for younger Medicaid members, 100% of the 70 million individuals, cost of healthy food, transport to the doctor can be really challenging. So we solve for that by radically streamlining enrollment into state and federal income-based programs like Medicaid, food stamps, utility assistance, which on average would unlock about $4,500 of copay reduction and cash assistance every year, and really going a long way to closing that financial gap to accessing critical care. Amazing programs, but because they're so hard to get enrolled into because of complex eligibility rules, complex paperwork, about 50% of those eligible and not enrolled.
I want to know a real example from each of you of where what you did moved the needle with one of those, with an underserved group, and they were at some point before and they were at some point after that made a difference because of what you guys and what your organization, your companies and products did.
So we've been lucky to get to partner with some of our Medicare Advantage plan partners to demonstrate the pretty broad, deep impact of what happens when we put $4,500 of cash and copay reduction in a member's pocket. And the short is that with that cash, with that copay reduction, they go and take their meds and they go see their PCP, they go see their specialist. So what do we see in the data? We see an average reduction in medical cost of about $1,400. So that's typically from reduced inpatient admissions and more expensive cost of care. That gets coupled with an increase in prescription costs for the health plan, which is good because it means that people are taking the meds that they need to. That then results in a significant increase in really important quality measures like blood pressure, A1C measures, med adherence, all those good quality measures. So those get significantly improved. And then the one that we really care about for a number of reasons is churn. So when we deliver our comprehensive enrollment services, more members stick with their health plan for longer. And that's really important because whether you're a health plan or you're a value-based provider, all of the investment you make in a given individual patient member is only as valuable as that person stays with you. So the longer you stay with them, the greater the impact that you can have.
And I want to raise the ugly point that you may have noticed there's an election coming up, and you may also have noticed that currently in the current administration, the health equity, diversity, inclusion, all that good stuff is actually, right there in CMS policy. It may not be, depending on who wins coming up in November in the US. So I don't know who wants to go with this, but what do you think that's going to mean for your work? Does anybody think that that's going to change anything? Are you going to have to double down on stuff? Are you going to have to change the way you behave? I want to get some things about where do we think health equity is going to be as a principle, in January, particularly if one side rather than the other wins.
Yeah, we've always taken the pretty cynical but realistic approach that to deliver a solution that scales and will continue to scale, that we have to deliver on top line revenue goals first. That plans our customers are not going to buy primarily on the outcomes, on the social determinants of health impact. And the reason why we, launched Juno is because there's a subset of the programs we support that drive immediate top line revenue value. So it sort of pays for the impact of all the health equity. In addition, as I mentioned earlier, one of the things we've really invested in is retention, which is an aspect of growth. So a secondary aspect of top line revenue.